Chapter 4.
23. Influence of destroying serous membranes on the production of mucus. No change. Serous membranes produce serous fluid within the serosa. This fluid is used to keep epithelium moist, friction-free movement. Mucus is produced in the mucosa and traps/removes foreign particles and bacteria from internal body surfaces. 24. What would happen if all cutaneous membranes were exposed to excessive sunlight? Excessive sunlight on the cutaneous membranes or the skin would cause UV radiation to affect the epidermis. 25. Influence of removing all epithelial tissues from synovial membranes on the function of the membrane. No change. Synovial membranes are made from connective tissues and aren't bound by epithelial tissues, therefore aren't affected. 26. What would happen if an endocrine gland was changed to an exocrine gland? If an endocrine were to become an exocrine gland, it would change its shape and gain branches as well as secreting through a duct to the surface. 27. Influence of removing all stem cells from a holocrine gland on a long-term function of that gland. Decrease. The holocrine gland has highly active stem cells which are needed to replace the cells that die during apoptosis and then secrete. 28. How could you tell if a tissue was undergoing hyperplasia or hypertrophy? If a tissue was undergoing hyperplasia, it would multiply in the amount of cells it has. If a tissue was undergoing hypertrophy, it would have the same amount of cells, but they would be bigger. 29. How could you tell if a cell is pluripotent? A pluripotent stem cell has the ability to differentiate into multiple different cell types. An example of this is embryonic stem cells. 30. Influence of gangrene in an organ on overall organ size. Decrease, because gangrene is a subcategory of necrosis in which a tissue will experience permanent pathological death due to a lack of oxygen in the tissue, so the organ would shrivel up and die.
Congratulations. How did you do?
Chapter 5. Study Guide.
1. How could you tell if somebody was performing dermatology? Correct. Examining, diagnosing, and treating skin conditions like integumentary system. 2. Influence of skin removal on the ability to detect external stimuli. Correct. Decrease. Without our skin, we would no longer have access to our sensory receptors that sense pressure and touch. We would also lose the Mersal cells, touch receptors, which aid in touch as well. Our free never-ending would be lost as well as getting rid of the ability to sense pain, heat, and cold. 3. How could you tell if an individual had melanocytes? Correct. Produces pigment, aka pigment vessels, to keratinocytes for pigment. The individual would have pigment in the skin. Melanocytes produce melanin to protect against cancer causing UV radiation. 4. Influence of destroying bone marrow on the likelihood of infection on the S. spinosum. Correct. Increasing the removal of bone marrow removes Langerhans cells, allowing infections and pathogens to thrive in our epidermis. 5. What would happen if keratinocytes cannot produce keratin granules? Yup, nice job. Keratinocytes are in the cell of the epidermis. The epidermis has different layers. Keratinocytes don't have several layers. The acid mantle is different than the keratin granules. These keratinocytes in the stratum spinosum main function is to produce keratin granules. These granules are a vesicle containing the keratin protein that is used later in the superficial layers of the epidermis. This keratin provides the body protection from external forces such as UV, water barrier, and infections because of its acid mantle that keeps a perfect range of pH 4 to 6. 6. What would happen if the keratinocyte stem cells of the stratum basal could not undergo mitosis? Keratinocyte stem cells undergo mitosis to produce new keratinocytes. If they cannot undergo mitosis, there will be no keratinocytes to replace exfoliated ones. On the top 4 layers of the epidermis would disappear within 30 to 40 days. 7. How could you tell if you were looking at the papillary layer or the reticular layer of the dermis? Correct. You can tell you are looking at the papillary layer when you visualize the dermal papillae interlocking with the epidermal ridges. The papillary layer also contains areolar connective tissue, nerve endings, and blood vessels. The reticular layer is composed of dense, irregular connective tissue with random arrangements of collagen, allowing moderate stresses. It also contains nerves, glands, and hair follicles. Papillary is superficial and adjacent to the epidermis. The reticular is deep and adjacent to the hypodermis. 8. How could you tell if an individual did not have the ability to produce melanin? Awesome job. Their skin will appear white/pale due to lacking melanin in their skin. This is known as albinism. Albinism is a genetic inability to produce melanin. Melanin is the primary skin pigment produced by melanocytes and stored in the keratinocytes. 9. What would happen to the skin if an individual had a non-functional liver? Correct. One of the functions of the liver is to remove bilirubin, hemoglobin breakdown product, from the blood. A non-functional liver would cause buildup of bilirubin in the blood and skin, which in turn would cause the individual to develop jaundice, making the skin turn yellow. 10. What is the physiological significance of friction ridges? Nice job. Friction ridges are ridges on the skin that act as a grip or grasp on surfaces. 7. What is the physiological significance of lanugo in the adult? Ooh, you on fire. Lanugo is fine hair found in the fetus. Before birth, all lanugo is usually gone. Terminal hair is what is important in adults, so lanugo hair has no significance on the adult. 12. What would happen if the hair matrix was destroyed? Yup, I knew you knew that one. If the hair matrix was destroyed, then there would essentially be no living cells in the hair pilus. The hair grows from mitotically active cells located in the bulb, and without them the hair wouldn't grow. 13. How could you tell if an individual's hair pili were round or flat from 20 feet away? Correct. The cross-sectional shapes of the hair pilus correlates with the shape of the individual's hair directly. Straight hair equals round pilus. Wavy equals oval pilus. Curly equals flat pilus. 14. Influence of increasing the amount of eumelanin in hair on the level of hair waviness. Nice job. No change. Hair texture is reliant on the cross-sectional shape of the hair pilus. Eumelanin would determine a specific color, brown or black. It is a pigment, so therefore it has no effect on the hair's texture. 15. What would happen if the mitosis in the nail matrix occurred at a faster rate than normal? Nice job, Winker. Since mitosis accounts for all nail growth in the matrix, the growth of the nail would produce faster. Mitotic cells would be stem cells. 16. How could you tell if an individual had bromidrosis? Good job. Bromidrosis causes the unpleasant smell of the individual in sweaty places. It is body odor produced by bacterial action in sweaty places. Bacteria metabolizing fatty acids secreted from the apocrine sweat glands. 17. What would happen if the sebaceous glands were selectively removed from an individual? You too smart. Sebum, an oily secretion, would not be produced without sebaceous glands. Hair would therefore be dry and brittle. Bacteria, viruses, and other potential contaminants would also find it easier to get in and on the skin, which can cause infection. 18. Influence of polythelia on sebum production. Fire! No change. The production of sebum is caused by the sebaceous gland, while polythelia is a genetic condition of having extra nipple along the mammary ridges, which is developed by the mammary gland. Having such condition does not impact sebum production. 19. Influence of deep wound healing on the skin on the chances of normal long-term function of the damaged area. See, you have this. Decrease. Although the epidermis may regenerate, the dermis with its lack of stem cells will undergo fibrosis and form scar tissue. 20. What would happen at the level of the hypodermis if an individual received a first-degree burn? Good job! First-degree burns of the epidermis is only layer affected. The surface of the skin will be red and recovers in a short period of time. Third-degree burn damages hypodermis, and meaning it would be destroyed. 21. What is the significance of the epithelial root sheath for recovery from a burn? Almost there. The epithelial root sheath contains stem cells that can regenerate the epidermis in the case of a second-degree burn, where the stem cells in the stratum basal would be too damaged to regenerate. 22. How could you tell if a burn was second or third degree? Yup, that's my baby. A second-degree burn burns the epidermis and dermis but leaves stem cells for regeneration in the epidermal root sheath for hair follicles. 23. Influence of increased melanin production on the probability of getting skin cancer. Too easy. Decrease. Individuals with increased melanin production will have a darker skin tone and therefore have a lower probability of getting skin cancer. Melanin is organized in the keratinocytes between their nuclei and the sun-blocking mutation causing UV radiation. 24. How could you tell if a tumor was basal cell carcinoma or a malignant melanoma? Yeah. Malignant melanoma generally metastasizes very quickly compared to basal cell carcinoma. Basal cell carcinoma appears as a central depression with a pearly edge compared to dark-colored spots for malignant melanoma. 25. Influence of abnormal keratinocyte growth on the formation of malignant melanoma. Congrats! No change. Abnormal keratinocyte growth leads to basal or squamous carcinomas. Malignant melanoma is caused by abnormal melanocyte growth.
Congrats! How did you do?
Chapter 6, Study Guide.
1. What is the physiological significance of the skeletal system? I knew you got that right. The skeletal system provides a structural framework and point of attachment for muscle. It also provides a physical protection of the brain and other internal organs. The skeletal system allows for movement and for anchor of the skeletal muscles. 2. How could you tell if you were observing an osseous tissue? Good job. You are able to tell if you are observing osseous tissue by noticing its characteristics like bone cells, fibers, ground substances, nerves, vasculature, and calcified matrix. They almost look ring-like under a microscope. Number 3. What is the physiologic significance of flat bones? I knew you got that one. Flat bones are unique as they are flat or curved instead of long. Their function is to provide a surface for muscle attachment, but they also provide various soft organs such as organs in the thoracic cavity. Your cranial protects your brain, ribs protect your lungs, and your hip bones protect your pelvic cavity. 4. What would happen if the epiphyses of long bones were not enlarged? Exactly right, Winky Bear. If the epiphyses were not too enlarged, then they wouldn't be able to attach to any ligaments or tendons, thus would cause the bones to have less mobility and risk of dislocations. 5. What would happen if the osteoblasts were selectively destroyed from a bone? Awesome sauce, Wink. Selectively destroying osteoblasts would result in destruction of the synthesis of organic matter protein of the matrix in the bone, which would result in no production of collagen in the bone, which would cause the bone's strength, resilience, and flexibility to decrease, making the bone brittle. 6. What is the physiologic significance of collagen in bone matrix? You're right, Winky Bear. Collagen fibers alternate directions in adjacent lamellae for strength. Also, it's typically the calcium or phosphate ions from the blood cover the collagen fibers to solidify the matrix, as well as give bone its characteristics of tensile strength, and protein synthesis declines with aging. Collagen also helps with brittleness. 7. What is the physiologic significance of bone being a composite? Right on the money, Winky. Bone being a composite means that it is made up of organic and inorganic matter, which provides the benefits of strength, flexibility, resisting compression, and supporting weight, while minimizing brittleness and bendiness. 8. Influence of removing caniculi on the ability of osteoclasts to communicate. Congratulations, Winky. Decrease. Caniculi serves as the channels for osteocytes to communicate with osteoclasts. Without them, bone function on regulation would lead to bone disorders. 9. How could you tell if a bone tissue was spongy or compact? You could tell if a tissue was compact by the placement on the bone. Compact bones form on the diaphysis of long bones and exterior of all bones. This osseous tissue is tightly packed and dense, providing protection and support for the body. Spongy bone can also be found commonly inside flat, compact bone structure and can also be found on the epiphysis of bones. The function has less organized tissue and can be organized as stress or pressure on the bone, and it is lightweight for fluid movement while still withholding its strength. 10. Influence of removing yellow bone marrow on the ability of immune system to fight infection. Nice job, Winky Bear. No change. Removing yellow bone marrow could not change the ability to fight infection. Yellow bone marrow replaces the red bone marrow as we get older because it becomes a storage for fat, and our need for immunity response of red bone marrow is lower. Red bone marrow can still migrate into spaces containing yellow bone marrow to aid in fighting off infections. 11. What would happen if intramembranous ossification failed? Awesome, Winky. Intramembranous ossification is one of the two mechanisms for formation of bone in an embryo. It produces spongy bone that is remodeled to form compact bone that make up the flat bones in our body. Without, we would lack bones like our skull bones that provide protection to our brain. 12. How could you tell by looking at a skeleton if an individual had a mesenchyme as an embryo? On the money, Winky. The skeleton would have flat bones present because of the intramembranous ossification, which forms flat bones directly from mesenchymal cells during this mechanism. 13. Influence of preventing ossification center formation during intramembranous ossification on the chances of having brain damage as an adult hit on the head. Good job, big smooshies. Increase. Intramembranous ossification is responsible for making flat bones, which can be found in the skull. The ossification center creates trabeculi, or spongy bone, which is followed by the formation of compact bone around it. If the ossification center was prevented from forming, the skull would not be protected by bone and be more susceptible to injury and brain damage. 14. Influence of selectively destroying chondrocytes in an embryo on the probability of successful endochondrial ossification. Good job. Decrease. Chondrocytes are important in the endochondrial ossification process because through proliferation they increase the length of the cartilage model, and through hypertrophy and apoptosis they create a cavity, which will eventually become the medullary cavity to form inside the cartilage model, which allows osteoblasts a space to begin the ossification process. 15. What is the physiologic significance of hypertrophy and hyperplasia of chondrocytes for endochondral ossification? Good job, Winky. Endochondral ossification is in very simple terms when cartilage becomes bone. Mesenchymal stem cells differentiate in chondroblasts, which create cartilage matrix. In step 2 of endochondral ossification, chondrocytes undergo both hypertrophy and hyperplasia. Chondrocytes go through hyperplasia to increase the length of cartilage model. When chondrocytes undergo hypertrophy, they die. They are cut off from nutrients due to great size, and it creates medullary cavities in the cartilage model, leading to osteoblasts starting to create bone from the inside out. Chondrocytes have to undergo hypertrophy and hyperplasia, continuing in steps 3, 4, 5, and 6 in the endochondral ossification process. 16. What would happen if the secondary ossification centers could not form during endochondral ossification? Nice work. Secondary ossification centers are located in the epiphyses of long bones. If these were not able to form, there will be no spongy bone in the middle of the epiphysis. This would lead to poor surface area for tendon and ligament attachment. 17. How could you tell if epiphyseal cartilage was articular cartilage on the epiphyseal plate? Good job, Winky. You could tell if epiphyseal cartilage was articular cartilage or the epiphyseal plate by looking at its location in the bone. The articular cartilage is on the outside of the bone and acts like a bumper, whereas the epiphyseal plate is between the diaphysis and the epiphysis. The epiphyseal plate's function is to allow long bone to grow in length. Number 18. Influence of premature closing of epiphyseal plate on an individual's height. You killing it. Decrease. Epiphyseal plates are made of hyaline cartilage, which allows the bone to elongate and grow a person's height. With premature closing of epiphyseal plate, bones wouldn't be as long, causing a shorter height. 19. What is the physiological significance of hypertrophy and hyperplasia of chondrocytes for bone lengthening? Nice job. Hypertrophy and hyperplasia cause the chondrocytes in the epiphyseal plate to grow and proliferate, causing hyaline cartilage to grow. As hyaline cartilage grows, it pushes epiphyses away from diaphyses, calcifies, and is replaced with bone by osseous cells, resulting in bone lengthening. 20. What would happen if osteoblasts could not dissolve bone during oppositional growth? Good job! Osteoblasts do not dissolve bone during oppositional growth, but instead create more bone to widen the already existing bone. Osteoclasts remove the bone during oppositional growth. 21. What would happen if osteoclasts were more active than osteoblasts during bone remodeling? Ooh, I love me Miss Smarty Pants. If osteoclasts were more active than osteoblasts, then there would be more bone removed during remodeling than there was being deposited by osteoblasts, which would lead to an imbalance, thus resulting in disease. 22. Influence of eliminating vitamin C from an individual on bone remodeling. Aw, I love you. Decrease. Vitamin C is needed directly for the synthesis on the main organic fiber in bone, collagen. 23. What would happen if non-bone tissue did not have calcification inhibitors? Just a few more, Winker. Without calcification inhibitors, collagen or non-bone tissue would mineralize, leading to ectoptic calcification. 24. Influence of preventing hydrogen secretion from osteoclasts on the ability to dissolve bone. Oh, I know you got that one. Decrease. Without a positive hydrogen secretion, negative chloride ions wouldn't follow any electrical attraction, which would then not be able to dissolve bone. 25. Influence of hypercalcemia on the likelihood of tetany. Good job, Winky. I'm really proud of you. Decrease. Hypercalcemia is the excessive blood calcium. Tetany is due to a deficiency in blood calcium, causing excitability in the nervous and muscular systems. If you have too much calcium, you are further away from too little. 26. Influence of increased calcitriol production on blood calcium levels. Just a few more, honey. Increase. Increased calcitriol raised blood calcium production, which already increases to increase intestinal absorption. 27. What is the physiologic significance of calcitriol? Good job. Calcitriol is vitamin D, which raises blood calcium production. It increases the intestinal absorption and promotes urinary reabsorption of calcium ions. Calcitriol also helps increase production and activity of osteoclasts to increase reabsorption in the skeleton. 28. Influence of cutaneous exposure to UV radiation on the ability to produce parathyroid hormone. Good job, Winky Bear. No change. Parathyroid hormones are produced by the parathyroid gland, and UV radiation affects calcitriol synthesis. 29. Influence of destroying the liver on calcium homeostasis. Almost had you there. Decrease. Destroying the liver would cause calciferol to turn into calcidiol in order for the kidneys to produce calcitriol. More PTH would need to be produced for a decrease in calcium absorption. 30. What would happen if calcitonin was overproduced? Almost there. If calcitonin was overproduced, there would be a decrease of blood calcium levels, leading to hypocalcemia. The kidneys would purge excess calcium in adults. 31. How could you tell if fracture repair was in the hematoma formation or bony callus formation phase? Good job. A hematoma is a bruise which, when a fracture breaks, a blood clot forms, and a clot forms early on a fracture or hematoma formation. Inflammation would begin to occur as well because phagocytes remove cellular debris. In regards to a bony callus formation phase, this would take about 3 to 4 months. This phase is when the osteoblasts produce trabeculae and spongy bone, which is then replaced by compact bone. Bone becomes wider than initial bone. 32. What would happen to fracture repair if an individual did not have osteoblasts? Good job. During fracture repair, osteoblasts produce trabeculae and spongy tissue, which eventually gets replaced by compact bone. So without osteoblasts, bones wouldn't form properly, leading to malfunctions. 33. Influence of inefficient bone remodeling on the time needed to heal a bone fracture. Nice job. Increase. Insufficient bone remodeling leads to slower deposition of bone. Other factors like osteoclasts wouldn't be able to form new bone or would take much longer to heal a bone fracture. Number 34. How could you tell if an individual had osteoporosis? Good job, Winker. When an individual has grown older in some cases, the active bone remodeling that had been driven by hormones for the growth and reabsorption is delayed by reduced osteoblast and osteoclast production. The osteoclast break down the bone structure and the osteoblast rebuilds and replaces. The bone's remodeling structure of the bone is then more brittle and weak without the correct ratio of osteoblast function compared to osteoclast, resulting in the disease osteoporosis. 35. What would happen to a bone tissue if a woman ran out of eggs? Amazing job, Winker! When women run out of eggs, their bone density begins to decrease, referred to osteoporosis, because they are no longer producing estrogen. Estrogen production is dependent on having eggs in the ovaries.
Congrats.